Growing stress and the labor shortage in recent years is creating a critical shortage of social workers, especially in Northeast Ohio's rural communities. Now, this fall, Kent State hopes to offer a new program at its satellite campuses to help fill that need. News 5's Catherine Ross explains why some say a new social work degree is a win-win for students and communities.
It's almost an if you build it, they will come scenario, but the buildings are already here, and so is the demand and the desire.
So even more than, hey, if you build it, they'll come. They're here. They just need the education to stay here.
Matthew Butler is a program consultant for Kent State. He's also a licensed independent social worker who lives and works in Ashtabula County and has seen the social worker shortage up close.
They've been hurting for staff, qualified, compassionate, well-trained staff.
According to a recent labor report, job listings for social workers in Northeast Ohio jumped 21% between 2019 and 2020. In the past decade, demand climbed by 165%. Most of those openings are in rural communities.
They just don't have the number of people living there, working there to stay in those communities. It's also made worse by just lack of funding issues.
It was a problem Kent State saw getting worse, and it's the reason the school plans to begin offering a Bachelor of Social Work degree with a hybrid program online and in person at its Ashtabula, Tuscarawas, and Salem campuses. The focus is on rural social work.
The need is there for the students, and the need is there for the agencies as well.
The school hopes offering the program on satellite campuses will make it more accessible for students who live in those areas, and then keep them in the area with access to internships and future jobs.
When you're talking about older students that may have not just transportation issues, but childcare issues, this is just a gigantic step forward for the rural counties that are involved in this project.
In places like Ashtabula County here, providers tell me social workers often have to wear multiple hats, filling in gaps for comprehensive services that would be available in more urban areas.
There's also an increase in need for social workers and for mental health services in general, especially now with the aftermath of COVID, and we've had a crisis with opiates in Ohio as well.
With more social workers needed to tackle bigger challenges, some in those rural communities say the program is coming at a critical time.
The communities are desperately crying out for help, and this is a way in which Kent State we hope is going to be able to make a big impact.
As long as it receives final approval from several state organizations, the new degree will take effect this coming fall. In Ashtabula, Catherine Ross, News 5.